we all know someone who's been affected by breast cancer, and that's because it's the most commonly diagnosed cancer in women in Canada. Fortunately, the survival rate following a breast cancer diagnosis is reaching an average of about 90%, and is even higher than that if the cancer is caught early enough. However, for many women that survive breast cancer, they then have to deal with many arm limitations and dysfunction following their treatment, sometimes for even several years after. Things like decreases in their shoulder range of motion and strength, and increases in their arm swelling and pain. There's less information, though, into how surgery, chemotherapy, and radiation affect the biomechanics, or the motion, of the shoulder complex. And that's where my research comes in. So quickly, the shoulder is made up of 3 bones, shown here in the picture on the left: the humerus, the scapula, or the shoulder blade, and the clavicle, or the collarbone, as well as many muscles, ligaments, and tendons that cross the joint that I unfortunately don't have time to tell you about today. So all of these elements work together in a complex rhythm to allow your shoulder to move in ways that no other joint in your body can. And that means if there are alterations in the biomechanics or interruptions in this rhythm, injury can result. So for breast cancer survivors specifically, if they have some sort of systematic change in their biomechanics or their motion after treatment, they can be at an even higher risk for further upper limb injury and further disability. So most biomechanics research into the shoulder function after breast cancer treatment has only looked at what's happening at the scapula during arm elevation. But I aim to find out if there are biomechanical differences during functional tasks. So think of reaching up to a high shelf for your favorite coffee mug, or across your body at your desk for your stapler, or lifting up your child or grandchild to play with them. These are all functional movements that are often performed many times throughout a day. So if there are changes in the kinematic patterns during these motions, that can lead to injury. And one such injury that is likely is shoulder impingement, shown here on the right. This occurs when the rotator cuff muscles are repeatedly pinched between the shoulder bones. That happens when the scapula doesn't tilt back enough and the humerus over-rotates, or your biomechanics are changed. So if I can figure out specifically how breast cancer survivors' shoulder biomechanics are altered after their treatment, and then through musculoskeletal modeling, sounds fancy, I know, determine why that's happening. So perhaps there are certain muscles that are weak after the treatment or are overloaded because of that. I can give all of this information to doctors and physical therapists to not only help the evaluation of shoulder function after breast cancer treatment, but hopefully improve the whole rehabilitation and return to work process for breast cancer survivors. Thank you.